Ever heard of a virus that jumps from bats to pigs to people? It sounds like something out of a movie, but it's very real. Today, we're diving deep into the Nipah virus. What is it? How does it spread? And how does it compare to other viruses we've become all too familiar with, like COVID-19? Let's get into it. The Nipah virus, or NIV, was first discovered in 1999 during an outbreak among pig farmers in Malaysia and Singapore. The name Nipah comes from the village in Malaysia where the first human patient was identified. So, what exactly is it? Nipah is a zoonotic virus, which means it can be transmitted from animals to humans. The natural hosts of this virus are fruit bats, specifically of the Pteropus genus, also known as flying foxes. These bats carry the virus but don't get sick from it. They're just carriers. So, how does it make the jump to humans? There are a few ways. The most common route is through direct contact with infected animals like pigs or bats. For example, if a fruit bat drops partially eaten fruit contaminated with its saliva or urine, and then a pig eats that fruit, the pig can get infected. A person handling that infected pig can then catch the virus. Another major way it spreads is through contaminated food. In places like Bangladesh and India, a common source of infection has been raw date palm sap. People collect this sweet sap from trees, but fruit bats are also attracted to it. They might lick the sap as it's being collected, contaminating it with the virus. Anyone who drinks that raw, unpasteurized sap is at risk. And yes, Nipah can also spread directly from person to person. This happens through close contact with an infected individual's bodily fluids, like saliva, respiratory droplets from coughing or sneezing, or even urine. This person-up-person transmission is especially a concern for family members, caring for a sick relative, and for healthcare workers treating Nipah patients without proper protective gear. This is why infection control in hospitals is so crucial during an outbreak. Now, let's talk about what happens when someone gets infected. The symptoms of Nipah virus can be quite severe. The incubation period, the time from exposure to the first symptoms ranges from about 4 to 14 days, but it can be as long as 45 days. Initially, it might feel like the flu. You could have a fever, headache, muscle pain, vomiting, and a sore throat. This can be followed by dizziness, drowsiness, and altered consciousness. But the really scary part is that Nipah can quickly progress to cause serious neurological problems. Many patients develop acute encephalitis, which is inflammation of the brain. This can lead to confusion, disorientation, and seizures. In severe cases, it can lead to a coma within 24 to 48 hours. The case fatality rate for Nipah is incredibly high, estimated to be between 40% and 75%. This varies depending on the outbreak and the availability of quality medical care. For those who do survive, some may experience long-term neurological conditions, like persistent seizures or personality changes. So, how is Nipah different from COVID-19? This is a great question. While both are zoonotic viruses that can cause respiratory illness, there are some key differences. First, the virus families are different. COVID-19 is caused by a coronavirus, while Nipah is a henipavirus. The primary mode of transmission is also a major distinction. COVID-19 is highly contagious and spreads primarily through airborne respiratory droplets. You can get it just by being in the same room as an infected person. Nipah, on the other hand, is less transmissible between people. It requires much closer contact with bodily fluids. This is why we see localized outbreaks of Nipah. Rather than a global pandemic, like we did with COVID-19, the severity and symptoms are another big difference. While COVID-19 has a wide spectrum of illness, from asymptomatic to severe, Nipah is generally much more deadly. The high fatality rate and the severe neurological damage it causes make Nipah a particularly frightening virus. There are currently no specific drugs or vaccines available for Nipah virus infection in humans, though several are in development. Treatment is limited to supportive care, which means managing the symptoms like fever and providing respiratory support. This brings us to the most important part: precautions. How can we protect ourselves, especially if we live in or are traveling to areas where Nipah outbreaks have occurred? The main strategy is to avoid exposure. First, practice good hygiene. Wash your hands thoroughly and frequently with soap and water, especially after being in contact with animals or sick people. Second, be very careful with food and drink. Avoid consuming raw date palm sap. If you do consume it, make sure it has been boiled first. Also, Thoroughly wash and peel all fruits before eating them. Discard any fruit that has signs of a bat bite or is found on the ground. Third, avoid contact with sick animals, especially pigs and bats. If you work with animals, wear protective gloves and clothing. In areas where fruit bats are common, try to protect your livestock's food and water sources from being contaminated by bats. Fourth, if you are near someone who is suspected of having Nipah, avoid close physical contact. Healthcare workers must use strict infection control measures, including wearing gowns, gloves, masks, and eye protection. Now, what about natural remedies? It's really important to be clear here. There are no scientifically proven natural remedies that can cure Nipah virus infection. The infection is extremely serious and requires immediate medical attention in a hospital. Relying solely on home remedies could be fatal. However, a strong immune system is always your best defense against any illness, so focusing on general health is a good idea. This means eating a balanced diet rich in vitamins and minerals, getting regular exercise, ensuring you get enough sleep, and managing stress. Things like vitamin C, zinc, and antioxidants found in fruits and vegetables can support your immune function. Herbs like turmeric and ginger have anti-inflammatory properties that can contribute to overall wellness. But let me repeat, these are for supporting your general health, not for treating an active Nipah infection. If you suspect you have been exposed to Nipah or are showing symptoms, please seek professional medical help immediately. So, to recap, Nipah is a dangerous virus transmitted from bats to other animals and humans. It spreads through contact with infected animals, contaminated food like raw date palm sap, or close contact with an infected person's bodily fluids. It's much deadlier than COVID-19, but less transmissible. Prevention is key. Wash your hands, be careful with your food, and avoid contact with sick animals and people. And remember, while a healthy lifestyle is always beneficial, it's no substitute for professional medical care if you get sick. Nipah virus remains a significant public health threat, and scientists around the world are working hard to develop vaccines and treatments. By staying informed and taking sensible precautions, we can protect ourselves and our communities from this deadly virus. Thanks for watching today. I hope this explanation was clear and helpful. If you found this video informative, please give it a thumbs up and consider subscribing for more deep dives into health and science. Stay safe, and I'll see you in the next video.